button now. So good afternoon, everybody. Thanks for joining today. And thank you for coming to this little presentation to help prepare for World Suicide Prevention Day and learn a little bit about how we can support those with thoughts of suicide in our communities and their caregivers, in particularly in this space, working in pharmacy. So I'm going to go and share my screen. Oh, oh, here. Get us going. Okay. So I'll just introduce myself. My name is Shauna Dewar. I work for Nova Scotia Health, and my role is community engagement lead on a project called Roots of Hope, which is about building capacity um, for those in community who are supporting people who are thinking about suicide and or grieving from suicide. My pronouns are she, her. I'm a white cisgendered woman here, and I've lost people to suicide. I support family members who have thoughts of suicide. So along with my professional hat, I also bring that personal experience to the space and acknowledge that you all have probably your own connections to suicide in whatever ways. And honor that. So please take the time you need during this talk. Again, it's being recorded, so if you need to step away for a moment, take a breath, or just need to do, whatever to take care of yourself, then you can always come back to this recording. Okay. And before we get started, I'll do a land acknowledgement. I'm not going to read this, but want to just acknowledge that we're here in Mi'kma'ki and the work that we do around suicide prevention. I'd like to take that lens as that being part of our truth and reconciliation work, acknowledging that a lot of the harms that have been done to Indigenous people have resulted in thoughts of suicide. And when I was reflecting on this particular presentation and thinking about the talk we're having today, just wanted to acknowledge that, for a lot of Indigenous folks, there can be that experience with medication and people having certain biases around how Indigenous people use medication, and that can really shape how we support people, which is not always very helpful. Acknowledging that this is also the birthplace of Black culture and heritage, and that for over 400 years, Black African Nova Scotians have been on this land, and thinking about how we can be misguided and thinking the research has shown how there can be that biases of believing that Black folks can endure pain more than others and have higher pain tolerances, which is not really true, and how that can impact the way that we support folks and with the 2SLGI plus community, and how they have also experienced harms within our health system. And so as we move into this conversation around suicide prevention, really holding that and being aware that those biases exist and how we have to challenge ourselves to create safe spaces for all and support all in their journeys as we try to make it through life, right? Okay. So just a little bit about Roots of Hope. As I mentioned, it's about building that capacity in community to support those that are thinking about suicide and or grieving from suicide. This is work through the Mental Health Commission of the Mental Health Commission of Canada, so that there's Roots of Hope work communities happening all over the country. And Nova Scotia started this work back in the fall of 2021. So it's been almost 4 years that I've been in this particular role. And we work under these 5 pillars here, specialized supports. So those are like programs and services that are meant to directly address those that are thinking about suicide and their caregivers, and those that are grieving from suicide. Training, education around suicide prevention, network building, connecting those that are doing this work with each other, public awareness campaigns, so really about reducing the stigma and bringing out awareness of what we can do to help support each other. Means restrictions, which this space are with pharmacies is where we're going to be focusing a bit on today. But that idea that when folks don't have access to complete their suicides, then we've increased that opportunity for those thoughts to come down and for people to be able to take a moment, pause, and hopefully redirect them back to life. And then research is a another big pillar that we have. So a lot of research sits in clinical spaces with suicide prevention work, and not as much is known about how we support in communities and the impact that community work can have in preventing suicide. So building up that body of literature is really important as we move forward with this work. So I'll start off by the next few couple slides talk just about the numbers, which can be a little bit challenging for folks sometimes. And I also find that in spaces like this, when we're working in a professional capacity, this is, well, I think actually everyone's curious sometimes about these things. Um, and so this is data up until 2021. It's open source data, so there's no secrets here per se, but just to bring some awareness of how suicide lands in different areas of our province here. And so you can see in our most recent numbers that we have that are publicly out there. We can see the Western zone and the Northern zone are our highest rates of suicide. And you can see that that number has gone up and down over the years, over the past over 10 years. So, so that's to say that things do fluctuate in the area of suicide loss, and that can be attributed to a number of different factors, everything from social supports, financial securities, economics, all kinds of things, access to healthcare. There has been no research study that has been done to create some understanding of why this is the way it is, but it is how it is. And then this next slide, we just see the dark blue represents males, the light blue represents females in Nova Scotia, and I believe all across Canada, there's not any data being collected that gives any finer detail around gender or any race-based data around suicide losses. So we have this very high level data here, and you'll see, and many of you probably are aware that men are more likely to die by suicide than women, with the highest rates being in that 45 to 59-year-old range. Although we are seeing some increases for those 80 plus amongst men. So what that translates in as far as like current needs, there's many people that are impacted by suicide loss and are experiencing that type of grief there. And these are just estimated numbers, of course, because each loss impacts a community differently, and can sometimes a few people are directly impacted. Sometimes it can impact a whole school or a whole small community. It all depends very much on the context of it. But just to note that suicide loss does impact people tremendously, and it's a grief that people hold on to forever, and that can impact people's lives and how they feel being in this world today. And then what we want to focus on too is a bit on just we know that when we've lost every person that we've lost to suicide, that there's a number of people that are being impacted, that kind of translates to the suicidal behaviors. So we don't have a really great way, and it's almost really impossible in some ways to collect how many people are thinking about suicide in Nova Scotia, because that requires a certain amount of disclosure and a certain number of understanding and that sort of thing. So so this is just estimated number, but the bigger message behind all this really is that for every loss, there are many more people who are in that pattern of thinking about suicide. They've lost their connection lives to life. They're feeling hopeless about their current situations. And most people don't go on to complete their suicide. So there's many times that we can intervene and support and help, and most of us will find our way and our path back to life. So the work that we do in suicide prevention work helps increase those pathways to life, and helps create more barriers to that path to suicide. So I want to share too that suicide prevention is a multifaceted approach. You know, there's not just one group of people, one profession, one way of going about preventing suicide in our communities. And so this particular model comes from Australia, and many of us probably can connect the idea that those people just are doing amazing work, right? Australia does some really cool stuff, right? And in their work around suicide prevention, they're very active. So this model comes from their work, and I put a little arrow there, just where our focus is in this conversation today around improving safety. So within Roots of Hope, I touch all these different areas. Under those 4 5 pillars in helping prevent suicide in community. But today we'll focus in specifically around improving safety and reducing access to the means of suicide. And we'll talk a little bit at the end of the presentation just about medication roundups and how they play an important role in creating safe communities. So if we put ourselves in that space of a pharmacist, and this is probably not new news to anyone here, but often suicide doesn't necessarily come up as something that people are thinking about that somebody else might be thinking about, right? And so the being connected to folks that are experiencing all of these different types of troubles, whether it's chronic pain, they're transitioning, they've got body images, they may be taking a leave from work, there's disabilities and mobility issues, terminal illnesses, and reproductive issues. And this is probably just even like a tip of the iceberg of all the things that you guys face in the day. And so it became, so not to say that all of these folks are thinking about suicide, but some of them may be thinking about suicide. So depending on how their journey is going and how they're dealing with some of these really big life challenges, suicide might be on the table for them. And just to, so we want to kind of just bring that as an idea that as a pharmacist, you could be encountering people who are thinking about suicide. Many of those people you probably are not aware of in this moment, unless you've already had the conversation or you've asked about it or they've disclosed it themselves. But majority of people, I will say, when they're thinking about suicide, it's not something they talk about. It's not an open conversation. Very few people may be aware of it, yet many people may be thinking about it. So we want to kind of just bring some awareness to that it is not uncommon for somebody who is experiencing any one of these or multiple of these to be thinking about suicide because life can be super challenging. And when we don't see a way to like where this moment of time when things are really rough is going to end, we don't see the other side, we can start losing hope. And that's a pretty normal and human response to it. So that's why asking about suicide is really important. Because when it is very difficult to talk about your own suicidal thoughts, it's difficult to bring up that conversation, and easier when someone asks directly to simply say, "Yes, I'm thinking about it," right? Rather than trying to muster up those words ourselves, right? And I wanted to share that asking about suicide is not going to put that thought in their head. It's not going to encourage them. It's going to be something that where if they're thinking about suicide, the thought already exists. And sometimes people can relate when I say this, we've all probably had a negative thought in our head once or twice, right? Um, and maybe you've had that experience of when you've had that negative thought and you've shared it with somebody else, that can sometimes release the pressure on that negative thought where it just helps you feel validated, or it may help you feel like, okay, like other people maybe have experienced this too, or somebody's relating to it. And talking about our negative thoughts can help us also appreciate other people's opinions or viewpoints, or we might even come up with our own viewpoint talking about it, right? And that's like thoughts of suicide. When we keep them in our heads, then it can be difficult. Excuse me. It can be difficult to let that thought go. it can be difficult not to reinforce that thought. So if I'm thinking, I am such a burden. Oh my goodness, everyone has to come in and take care of me. Or I just feel like I'm always, complaining about stuff, right? Like if people would be better off without me. We can reinforce that thought a lot in our own minds. But once we put it out there, right, then there's an opportunity for it to be challenged or for us to come to a different understanding in that. So this idea about asking about suicide is something that, as the support person, the person that is not thinking about suicide at the moment, is there to ask so that we can help bring that negative thought, or difficult thought from our inside the head outside, and to have an opportunity to talk about it. So it could start off says this is just there is no perfect script, right? So you are going to do you and be you, and that's the best. That's the best that any of us can do, right? So it might start with how you've been feeling lately. So you're thinking about some of the people that are using your services, and they may say, like you just may have that inkling and concern about them, right? That they're not doing well. So then, we want to respond to that by saying, it's sometimes when people are experiencing chronic pain, or sometimes when people are transitioning, whatever the circumstances, fill in the blank of where they're at in life, they think about suicide. Are you thinking about suicide? Right? So we just kind of open it up. And if they say no, they say no. And we can believe them if they say no, right? We're not there to challenge it. We're not there to contest that. They may not be thinking about it. They may be thinking about it, but they want to say no to you because maybe they feel that they're not ready to talk about that. Or maybe you're not the person to talk about that, and that's okay too. But we've done our best to help support that person and ask the question. So sometimes, our concern is, well, what if they do say yes? Like, what do I do with that, right? That's a lot, and it is. So sometimes we get into our thinking where if someone is thinking about suicide, our objective is to get them to stop thinking about that, right? Like we don't want people thinking about suicide, which is true, right? But if we can shift our mindset a little bit around trying to be putting in a position of how do I stop you to thinking about suicide? And then thinking, well, I have no idea how to stop you from thinking about suicide. I'm not a mental health professional. I'm not a clinician. I'm not a therapist. I don't know how to make people stop doing that, right? Shift the thinking into how can I help this person get to a life worth living? All right. So in community, we are trying to focus in on those life paths, right? And if there's something that I can do to help somebody get a little bit more comfortable, feel a little bit more better about life, like that's kind of the role that I'm in, right? So, and when we have conversations early about suicidal thoughts, often there's many things we can do within community to make life better for folks, right? So we want to have these conversations early and try to help and support in our own roles in what we do and what we do best to help create those lives worth living. So our response if somebody was thinking about suicide, say, wow, okay, this is really important. I'm glad you told me. There are many reasons why someone might be thinking about suicide. Some of them I can help with directly. So think of as a pharmacist, what can I directly help with, right? And those are things you're going to feel more confident in doing, right? So I need to hear more about what is going on so I know how I can help. Can you tell me why life does not feel like worth living right now? So that right now is kind of just focusing in on this moment because if the thoughts are active, right, then something's happened that's like activated those thoughts, right? Maybe a bad encounter with somebody, maybe something that was disappointing. They, got a call that they didn't get the job or whatever it might be. So, but, it's not necessarily that to hear the whole life story and all the challenges that they have in the world, but right now, what's going on for you, right? And what we're listening for, particularly in this role as pharmacists, is this something connected to their medications and something that I might be able to help out with, right? Um, And so we're listening for that. And then if there's an opportunity there, whether it's like medication management, whether it is reassessing the medication, you folks know all the 100 things that you could do to help support somebody in that medication journey. And that might be what helps give people hope that, okay, this is not a great situation right now. What I'm dealing with is really crappy. And it's going to get better, right? So maybe it's even a conversation around how this medication's impacting you. Maybe the side effects are not what you were expecting. Maybe there's ways that we can mediate those side effects. Maybe just knowing that that is a side effect and that's normal, and let's figure out how we work through that, right? So these are conversations that I'm sure you probably feel comfortable with around it, and probably are having these conversations already, right? You probably don't know maybe that the person might be thinking about suicide, but I feel very confident that you're already having a zillion conversations around this that is helping create hope for folks and creating life worth living for them. And of course, there's going to be many situations where it has nothing to do with their medication, but what is just going on in their life in general. So, in this wheel here, you can see that there are a number of different things that can impact somebody's thoughts of suicide and their journey in life. And this is reality for a lot of us, right? None of us get through life without having some sort of disappointments and loss and challenges and heartaches and hardships, right? It's life, right? And when we have supports in place and we have people that are connected that can connect us to supports, life gets manageable and we find ourselves back on track in that. So, uh, there are folks though that where the support systems aren't super, and there's challenges that people have that where they don't know who to talk to and where to get help with, right? So if the thoughts of suicide, if they're not connected to your role as a pharmacist and what you can do within your scope of practice, then it's like navigating that to another place, right? For folks and there's people who are experts in their own spaces that can help. So if the person that you're talking to, if there's thoughts of suicide there and they kind of need to, you're feeling like unload, right? They need to get a lot off their chest, right? It's feeling heavy. And depending on your situation, the time of day, what's going on for you, you may be able to hold that space and feel comfortable holding that space. And some people won't be able to hold that space for a number of different reasons. So, if you're not already familiar with 988, this is a national resource that is 24/7, and you can call as a person with thoughts of suicide. You can also call as a caregiver. You can also call as a pharmacist and said, I just had this conversation with this person, and I'm not sure if I said the right thing or if I'm not sure if I did a good job. You can call these folks and and talk to them. They are very well trained and understand all kinds of different things around supporting someone with thoughts of suicide, and they're there to talk to. Right. So it could be in a moment of crisis, but it doesn't have to be a moment of crisis, right? So just doing that warm handoff to 988. So I do care about you. I'm not feeling like I don't have the time right now, or I'm not feeling like I'm able to right now, but here are some folks that you can talk to. May be helpful. And of course, we also have our Nova Scotia Health Resources. So there's the crisis line. So if feels more immediate and someone needs help right away, there's that line to call there. There's also, our general intake line. So if it's not feeling quite crisis, meaning that the death is imminent or the thoughts are super active, but that what they're experiencing may be related to a deeper mental health issue. Then calling the intake line is another option. And sometimes folks, you know, it's not like a mental health illness. It's not necessarily like the help that's needed is not necessarily a therapist who is required to do that help, right? So as I said, many of us get into places where in situations where life is really tough and you're just like, when is this going to end? How much more can I take? Right? And we really need help just getting our lives back on order and getting things where we want them to be. So, some of you may already be familiar with 211. So, they are our Nova Scotia resource where they have the eyes and ears on what's going on in community, all those community resources, connections by each community, by whatever people are dealing with, whether it's intimate partner violence, whether it's food or housing insecurity, whether it's just feeling a sense of isolation and loneliness, whether it's connecting to SLBGI plus groups, whatever it might be, whatever challenge we have, right? 211 is a great resource to help get people connected to people who are experts in those spaces, right? And so lots of different folks there. We also have our Nova Scotia peer support groups, which those are amazing folks that just have been on the path, right? And when you've walked the walk, right, it's connecting to those people and just knowing that some of these life challenges, they're not always people's fault, right? Things happen to people. And despite our best intentions to keep our life straight and narrow and on the good path, things happen to folks, right? And so knowing that there's other people who have also experienced certain challenges can be super helpful in just helping people um, get connected back to life and develop strategies and ways to do that. So these are just a few examples of different things that are happening in communities. So I know we're all across the province and there's all kinds of great community groups and whether grassroots groups, whether and registered nonprofits, lots of folks doing amazing work, right? So I'm sure many of you are already connected to a lot of the community resources in there, but it can be challenging sometimes to keep up with everything because it's very changes a lot, right? That's how funding works. These all work on programs and projects, funding. So, one day there's a program and the next day there's a different program. So just encourage you to connect to your community and reach out. And again, 211 is a great resource for that to help keep connected. And there has been a lot more work happening in Nova Scotia since the mass casualty around grief support. So the Nova Scotia Hospice Palliative Care folks, they have been doing launches for community grants to do work to support grief. And then Bereaved Families of Nova Scotia works on a provincial capacity. They're doing a lot of amazing work to help support grief. So um, again, just encouraging people to connect with that, to understand a little bit more what's happening in grief spaces, because some of the more traditional ways, like through churches and that sort of thing, not everybody's connected to those places, and so there's been a bit of a gap for a little while in supporting people with grief, and there's lots of great folks within the province and within community who are helping to close that gap in that area, because that can be a huge piece for folks. So just far as like next steps as a pharmacist, just to kind of like sum things up around, what to do when someone's thinking about suicide and that becomes in your awareness, right? Thinking about things that can be in your role, right? And what can you do in that piece? So, like, you may have connections, contacts, colleagues that you can refer to people to, or better understand how to support somebody, not with their thoughts of suicide per se. That could be it too, but more so thinking just as a pharmacist, like, how do I help this person in their journey, dealing with whether they're dealing when medication is part of that path, and how to make just more, have more choices, more agency involved in that. For those that are in a space where we can support their gender affirming care, right? That is huge, right? To be an ally in that space. As a health professional, just we can understand systems in a certain way. We have connections and just just a better understanding sometimes than a general population around how to navigate through the maze of getting health care. So that can be supportive, connecting folks to community supports and resources. And then if it feels right, like following up with people, right? And giving that space just to check in with them and see how they're doing, right? Because for those that are thinking about suicide, sometimes like that feeling like a burden, feeling like isolated, feeling alone in their thoughts, right? So just knowing that there's someone who's checking in on you and cares and understands where you're at with stuff can be super helpful. And before we kind of just leave this space here, if there is a concern that somebody is thinking about suicide and that they may be at risk there, then our next step would be a safety plan. We're not going to go into the process of doing safety plan in this space. Just due to the time and that sort of thing. So some of you may be very familiar with safety planning, and if that feels right for you, amazing. Go ahead and just create that safety plan. But what we want to make sure is that at the end of our conversation with someone with thoughts of suicide is, are you safe right now? Is there anything we need to do to keep you safe, right? And that may mean a trip to the ER, or that might mean a call to police to help create increase safety. Um, Many times, though, it can be just talking to somebody and say, okay, who are your supports in place? Like, what are you up to now? Like, do you have, access? Like just getting a sense of that and creating a plan around that. And because many people will not be in crisis during this conversation. Um, and if you're feeling like if they are like, yeah, I actually need some help keeping safe right now, and you're not the person to do it, which is completely okay, that's when you can call 988. Right. And those folks can walk you through safety plan. Right. Kids Help Phone can also work through safety plan. Mental health crisis line, they could walk you through a safety plan or walk that person through a safety plan. So but just knowing before you leave that conversation that that person feels safe, and you just have to trust what they say and go from there with that of what they want to do next in keeping themselves safe. So to sum up this little piece here around just talking to someone about thoughts of suicide, and so I speak as somebody who works with Nova Scotia Health, and know that sometimes folks can feel like the only time their thoughts of suicide really matter is when it's in a moment of crisis, that they're only going to get help when the death is imminent, right? And we really want to try to change that narrative into acknowledging that people have all kinds of thoughts of suicide at different degrees of severity, from mild to passing thoughts of it, just feeling like life's not worth living, or I just wish this was all over, or wouldn't care if I didn't wake up, to, very severe, ready to act type of thoughts there. And when they have connections in with mental health professionals, like we need to validate any type of thoughts of suicide, right? It all matters. That person matters, that they're not alone, that there is hope, right? We don't need to wait till the moment of crisis to provide listening ears and compassion and ways to help build hope along that. So as a just to finish up this conversation today, so I'm super excited to partner with Alex and the Bloom pharmacies, and all pharmacies obviously are part of this, but this idea of reducing means is a key part of suicide prevention in community, and that idea of encouraging medication roundups, which I'm sure you're all familiar with that concept of, that people, can carry and hold lots of medication for a long time in their cabinets and in their homes and that sort of thing. And what rounding up that medication and getting rid of it and disposing of it properly and safely does is, if there's someone with thoughts of suicide in your home and those thoughts become active, sometimes there can be a very short window from the thoughts being active to that impulsivity and acting on the thoughts. And when means are available, aka there's lots of prescriptions in our cabinet and they're there, I just have to do it, then the impulsivity kicks in and people can act quickly. So if we don't have those medications in our home, or even things like having pills in the forgive me, but the little pop out things, right? Where you take one pill at a time, right? Type of thing. Those things slow people down, right? If it's not readily available, people have to then think about, okay, how do I do this? How do I make this happen, right? And time can sometimes be our best friend in these situations because the active thoughts start coming down as more time passes, right? So so Alex and Cass, with our communication persons, have been gracious enough to help me kind of help promote this idea of a medication roundup. And so this information session is the first step, and hopefully helps just create some comfort around this idea, acknowledging that encouraging medication roundups in relation to suicide prevention may encourage people in the community to reach out. It may encourage people to have some conversation and they may reach out to you. And that is amazing. And that's a really good thing and can feel super overwhelming if people are not comfortable holding that space. So hopefully this has helped create more comfort for anybody who was feeling unsure about that, to know that, no one's life depends on you. Everyone has their agency, and we're going to do our best to help support people as they move through, and hopefully keep them here and get them connected back to life. So Cass has been working on the communications plan and all that. So we'll just what you'll see during World Suicide Prevention Day is September 10th, and Suicide Prevention Awareness Month is September. So during that time, you may see a little bit more promotion around medication roundups. It's not targeting just Bloom pharmacies, but just all pharmacies, as that's a practice that any pharmacy can do. And so hopefully we'll see some people encouraged to return medications, especially for those that may have people with thoughts of suicide in their home. And that's so much of a private thing that lots of families are dealing with, that maybe no one else knows about it, but hopefully bringing some awareness that, listen, if you have someone with thoughts of suicide in your home and you got a lot of medications in the cabinet, let's just clear those out, right? Let's create that increased time that person has. So you'll see some more, maybe some things on Facebook and socials, and that's right that. And for anybody who's interested, we've created this little rack card here that just really describes what a medication roundup is, why it matters. It talks a little bit, some myths that people might have around suicide. And then there's a QR code there that leads to that document around saying exactly how to safely dispose your medications, and that. So, and then it has some numbers there on the bottom to encourage people if they need to talk now. There's some different helplines that can be super helpful. So if people feel like this would be some literature that they would like to have at their pharmacy, to have on hand, should these conversations come up, or just help promote medication roundups, that would be amazing. And here's my contact information. I think you all have Alex's contact information, but here I am. So if there's any questions you have after this presentation, or like 20 days from now, 2 months from now, 2 years from now, give me a call, send me an email if there's something that you feel I can help with, and just help inform more about suicide prevention work or support a conversation or a person that you're having in your community. So I will stop sharing now. Okay. So that is the presentation there. So we have some time for any questions, comments, concerns about anything.
I'm just going to say thanks so much, Shauna. I really appreciate this. I'm sure folks also really appreciate this. If folks don't want to ask questions in the open, like videoed environment that we're in, I also welcome questions through email, and I can create a document and send them on to Shauna. And if folks can't speak or put their video on, you can write it in the chat, like whatever works for people. But thank you really, 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 I really appreciate it.
Thank you. Thanks, Jen. Jen, I'm assuming that's their hand clapping and not a hand raise.
Yes, thank you very much. That was really helpful.
Great. Thanks, Jen. I'm going to pause the recording at this point. So, for anybody who's watching this after the fact, thanks for tuning in. Thanks for taking some interest in this. Reach out if you have any questions or concerns about anything, and happy to support. And thank you for all you do in your communities. I'm going to pause recording now.